Do not ignore these 3 signs because most people don't even know that the tooth is infected until it is too late. And then they run the risk of it hurting, them having abscess, or their tooth swelling up and the side of their face looking like there's a golf ball inside of it. Which isn't gonna be you because you're gonna learn the 3 reasons you need a root canal even though your tooth doesn't hurt. I'm Dr. B, and here's everything you need to know in the top 3 signs. Number 1 is that your tooth looks oddly dark. It's almost like the lights of the tooth have been turned off. And this is easiest to see on your very front tooth because it's front and center and everybody else can see it. If you've ever had anybody tell you you need to get your front tooth looked at because it looks strange, it may be because it needs a root canal and the nerve of the tooth has died. Because it has no more vitality, it has no more blood supply that can make the tooth vital or bright. And when the nerve dies in the tooth turns dark, which is one of the first signs of you needing a root canal, and it doesn't hurt, you don't notice it other than people telling you, hey, your front tooth looks really, really oddly dark. So how do we fix this? We do a root canal and the tooth is fixed. Sometimes we can put bleach in it to get it to be a little bit brighter, sometimes we have to crown it, sometimes we have to veneer it. But a really, really simple fix. It's important to fix this before the problem gets bigger and you get swelling on your front tooth. The second sign is that you have a bump on your gum. Look, when a tooth dies, it becomes infected with bacteria and the end of the root looks like this. This is a localized infection on the end of your root, and a lot of times that drains out the side of your gums. And when that happens, you get a little bump on the outside of your gum, but really, really down far in your bone. So typically it drains from the end of the root, and the end of the root is actually a lot farther down than you think. And this is a reason the dentists take x-rays so that they can examine the ends of the root to see if there's this little halo or infection on the end of it. And if we do see that, we are going to recommend that you need a root canal. But one of the first signs of needing a root canal, a lot of times this doesn't hurt. A lot of people don't even realize they have this, but they have a bump on their gum. This can also happen from a reinfected root canal. So you had a root canal like many, many years ago and that tooth is reinfected and you notice it just feels weird. It feels odd when you bite down. It kind of hurts a little bit, but the tooth's been root canal, so you don't really realize what's going on. It doesn't make sense. And it's because it is possible that that old root canal that you've got 20 years ago is now reinfected. The other thing is that patients are going to notice this kind of foul taste in their mouth. They're going to notice that that gum is a little bit irritated and it kind of tastes like a metallic taste, which kind of tastes really, really gross. But what's happening is that infection is draining out the side of your bone into your gums. Another sign that your tooth might need a root canal is the fact that it's really, really cold. Cold things bother. You're drinking cold water, you have ice that goes on the tooth, and it just is chilly. It just feels so much different than the other teeth. What's even worse is if that tooth lingers in the cold once the cold is removed from the tooth. So what I mean is you're like drinking a soda, that tooth is really irritated, it's really sore, and it's almost painful. And once that cold is removed from your tooth, it doesn't feel cold. It feels cold for like 30 seconds, 40 seconds, maybe up to a minute after that. It just feels incredibly cold. What that usually means is that the nerve has some sort of trauma or bacteria inside of it, and that eventually is going to take over the tooth and could mean you need a root canal because that tooth is eventually going to die, the bacteria will take over, and the tooth eventually, it loses its nerve. It doesn't have the ability to transmit pain after that, which means the bacteria takes over and then you get the bump on your gums or the tooth turns really dark and then you need a root canal. Now, if you do need a root canal, a lot of patients just ask me, I don't even know what that is. A root canal is basically how we're going to clean out the nerves of the tooth and stop the transmission of pain from the tooth to your brain. I'll run through the process like super quickly so that I promise you, if you do need a root canal, it's not going to be that scary. It's actually not a big scary procedure. A lot of people are worried about it, but it takes maybe an hour or two, and then the tooth immediately stops pain. And if you had pain before, your pain is now stopped. If you didn't have pain before, now the bacteria is stopped and it won't progress more. What happens if you don't do a root canal is the bacteria gets bigger and bigger and bigger, and that's when your face swells up and you end up in the ER. So basically, the goal of a root canal is to clean out the nerve of the tooth. So we use these little files to clean out the canals of the tooth. The nerve basically has 2 components. It has a nerve chamber and it has canals. Different teeth have different canals. Like your front tooth likely has 1 canal, your back teeth have 3 to 4. So when you look at a root canal on an x-ray, it looks like it has these little white fillings in there, which is essentially the sealer. We mechanically use these files to clean out part of the nerve, and then we seal it with a sealer, which on the x-ray looks white. And the next question patients always ask me is, do root canals hurt? And no, they don't hurt because you are super, super numb. A dentist or an endodontist, which is a root canal specialist, is going to get your tooth super numb and you're not going to feel anything. And once you have the root canal finished, one of the most important things that has been scientifically proven is that you need to get a crown on top of it if it is a back tooth. A back tooth is going to need a crown because it needs to be sealed, not only from the root canal, but a filling on top of it, and it needs to be sealed a 3rd time, which is the crown on top of there. If you get a root canal and you do not get a crown, statistically, it's only going to last half the lifespan as though you did have a crown on it. So super important to get a crown if it's on your back tooth when you get a root canal. So a lot of patients walk around not knowing that they need a root canal. Just because their tooth doesn't hurt doesn't mean that there isn't a problem. That's why we need to take x-rays at the dentist. When you go in and you complain about those x-rays and they're hurting your mouth and you're saying, I just don't want to get x-rays, this is one of the things that we're looking for when we take x-rays. There's a thing called an FMX, which is a full mouth. There's a thing we called FMX, and FMX is a full mouth series of x-rays. It's when you go into the dentist for the first time and they take a series of 18 pictures, you're like, holy cow, that is a ton of x-rays. Why do we have to do that many x-rays? It's because a lot of these x-rays are specifically looking for the ends of your roots. And on the ends of your roots, if we see something like this, which is a radiolucency or an infection, we immediately know that that tooth could explode on you and get bigger and bigger in that infection. And that infection, of course, spreads to the rest of your body because it's tied to the blood supply. So that infection that's in your tooth can actually spread throughout your body. And a lot of patients don't know this, but it can actually go into your sinus and cause sinus problems. If you have an infected tooth on your top tooth and it goes inside your sinus, it could infect the sinus and actually you could have unilateral sinus congestion, meaning that you're always plugged up on the right side for some reason. And a lot of times people will finally find out that it is actually a tooth that is causing all this problem. That it is your molar that is causing all of these sinus problems. So if you suffer from sinus problems, it could be because of your tooth. So there we have it, 3 reasons you need a root canal, even though you have no idea that you need one or you have no signs of you needing one. Even though the tooth doesn't hurt, it doesn't bother you, it's very possible you need a root canal on this, but of course, call your doctor, don't take my advice. Now, the only purpose of this video is so I can educate you on if you need a root canal or what signs are, or what the signs are at home so that you can recognize from your own house if you need to have further treatment, or if you need a root canal, or if you don't. You need to talk to your doctor. They're going to make the diagnosis. They have the x-rays, they have the instruments. They have lots of different knowledge in different ways. They have lots of knowledge in different ways to test whether your tooth does or doesn't need a root canal. So if you're on the fence about it, go see your doctor. Don't just take my word for it and think, on this channel, I serve only as a guide for you. And if you're interested in other videos that talk about gums, gum health, implants, anything dental related, I have so many more videos on different topics about different things dental related so that I can help you learn about your teeth. I'm just a dentist, and thank you for watching.